ecstatic. We were, I mean, never in a million years would you have thought this would happen so quickly. We were shocked and we were angry, and we felt um, we felt sort of powerless to do anything. So we said, okay, let's just start a GoFundMe, and if we can raise $500, then we'll be happy. At least it's something. And it just totally took off. And I mean, we're not, we didn't manage to get a famous spokesperson or anything like that. It's really through word of mouth, and it really goes to show how there is a solidarity that exists between healthcare professionals. And this, beyond the money, I really hope it continues a discussion on the value that we give to the voice of healthcare workers when they're critiquing. And a critique is not the same as trying to shame somebody or humiliate somebody or insult somebody. We have to be, we're professionals. We should be able to make that distinction. And it's really a shame that in this case, the SRNA saw this as an offense rather than an opportunity for dialogue. But in a lot of places, the official channels are more convenient for the institution than they are for patients and their families. Our healthcare system is notoriously very, very difficult to navigate, even for healthcare professionals at times. And the secrecy that surrounds the complaint system sort of encourages people to not use them, because the people are afraid to be labeled as difficult or as problematic. And whether it's your workplace or the place where a loved one is receiving care, you don't want them to be on the receiving end of people getting angry at you. So there needs to be more transparency, maybe some kind of forum, some kind of independent, like a white wall type thing. There's some places I know where hospitals are encouraged to discuss how many staff they have with the ratios to the patients. So there's a lot of data on the importance of having safe staffing ratios in terms of registered nurses and patients. So there's a lot of data out there that can make our hospitals and our institutions safer. And it's dangerous to be chronically understaffed or to be chronically under-equipped, and we're never allowed to talk about that, not publicly anyway. And the so-called official channels, they're very hard to study. There's not that much research on them because they tend to be very shrouded in secrecy. But what little data we do have tends to suggest that they don't work at best, and at worst they can actually do damage to the person that complains. So I think that's a discussion we really need to have if we're genuine about wanting to improve our healthcare system.